Hi everybody, and welcome to another episode with the Anxious Resistance. Today we're going to be talking about a class of medications, and they are called beta blockers. So beta blockers are often used off-label for anxiety disorders, particularly things like social anxiety disorder, because they're good medications that take away the symptoms of anxiety. So they'll take away the racing heart, the sweating, the high blood pressure. And so that's why for a long time that these have been used to help with that, especially since you can take them, they kick in a small matter of time. You can use them for certain situations. So you can use them, if you're giving a speech, or if you're going to a social event, or if you're going on a date, whatever the case may be. This is something that you can take, beforehand, and it can take away those anxiety symptoms. So the most common one is called Inderal or Propranolol. This one is used very often because it's shown to work best as a short-term treatment for specific types of anxiety. So that's why that one is used a lot. And also Tenormin is used quite a bit, also called Atenolol. So one really good thing about beta blockers is that they can be used to break you out of the cycle of a panic. So if somebody's having a panic attack, you can take the beta blocker, and it takes away that racing heart, that high blood pressure, that sweating, and allows you to break out of that cycle. So it allows you to have your body calm down enough that you yourself can regain control of your thoughts and your mind, and be able to reorient yourself and bring yourself back to reality, to earth, where your anxiety may seem unrealistic and you'll begin to recover. So beta blockers actually hold several benefits over other anxiety medications, such as benzodiazepines. Benzodiazepines, in case you don't know, are medications like Xanax or Ativan or Klonopin are some of the most commonly used ones, also Valium. But these medications come with a lot of risk. One of them being is that you can become tolerant to them, and you can also become addicted to them. So they are Schedule 4 controlled substances, where beta blockers are not Schedule 4. They're not even on the schedule. So you don't have to worry about becoming addicted to them, at least physically. Benzodiazepines have also been linked to some serious long-term side effects, such as dementia and mental decline. And so it's something that a lot of physicians are really trying to get away from, and for very good reason. Often you will see beta blockers prescribed for anxiety before you see something like a benzo prescribed these days. So there was a time in my mental health journey where I took a beta blocker. I took propranolol, also called Inderal. I took it for a short amount of time because when I would take it, it didn't work for me. It really didn't help. It didn't take away any symptoms, which can be the case sometimes with medications. They just don't work right for you. Now, I do believe that I could have tried other beta blockers because they're chemically similar, but they're not the same. So I may have done better on a different one, but I never really got around to trying it. We ended up trying different classes of medication instead. But there's something that are an option for you if you're struggling with anxiety, particularly something like social anxiety disorder. So ask your physician about this medication if it's something you think might work for you and might benefit you. Again, my experience isn't reflective of everybody's. There are a lot of people who say that they really do well on beta blockers, and it really takes away a lot of their anxiety symptoms. So look into it, and always talk to your physician before you start taking any new medications or adding a new medication to your list. And as always, thank you so much for watching this video with the Anxious Resistance. If you enjoyed this content, please like the video. If you have questions, comment them down below. We do our best to answer questions and respond to comments. And thank you so much for watching.